I'm reading a book that I have found to be fascinating called House of Pain. And it's the book about the Sackler family and the Purdue Pharma Company and the use of OxyContin in management of pain and all of the problems associated with that. There were some historical things that I didn't fully appreciate but came to understand when I was reading this book. One thing that was happening in the 1930s was that penicillin had come out as a medication that was able to cure a bacterial infection. At that time, bacterial infections would be a death sentence for some patients, and there was this drug, a miracle drug, that could be used to treat an otherwise untreatable infection. So there became a thought in the population that a pill could cure a disease. And so all we really needed to do was find all the pills, and that was the answer for curing the diseases. And so this process led to the development by the drug companies of many medications, and they were being promoted as cures for a variety of illnesses and diseases. There's no question that the development of drugs by the pharmaceutical industry and the medical industry in general has been a wonderful thing in modern medicine. But I think that if we rely on a single treatment to cure a problem, we rarely end up with the result that we want. COVID has taught us this. Patients we know can get a vaccination and decrease their risk of dying from COVID. But they could also decrease their risk by being healthier, by losing weight perhaps, or controlling diabetes, or other kinds of medical illnesses, because patients with those medical illnesses are at higher risk of having problems with COVID. Our approach to musculoskeletal and cranial health is that we need to look at making improvements in everything we can do. Surgery may be beneficial in some cases, but it should always be in conjunction with other treatments. We should always be thinking about diet and nutrition as a foundational principle for good health, and especially good musculoskeletal health. We should always be thinking about our activity levels, the types of activity we're engaged in. Is it safe or not safe? Is it the right kinds of activity? Is it something we enjoy and get satisfaction out of? And also, is it enough activity to strengthen the bones and the muscle and the ligaments, which we all really need to be healthy? Do we have good social relationships? Social relationships have been found to be the #1 predictor of a healthy life by several institutions, and we oftentimes overlook that. Sometimes patients would benefit from improving their social relationships. Harmful substances can be a big problem for many people. Tobacco, overuse of alcohol, even caffeine, and definitely sugar should all be looked at. We know that narcotics can have a negative impact on patients' health. So I think that as we consider trying to give the best care to our patients, we do so by helping them to look at all aspects of their health and improve wherever they can. And I do believe that if small and incremental improvements are made in lots of areas, that's where we get the best outcomes. So in summary, this book really highlighted a fallacy in our medical thinking, that a pill cures a disease, which may in some cases happen, but generally speaking, it's a lot of things all put together that help us live the healthiest lives possible.